Other studies have looked at overall psychological and physiological health being impacted by microaggressions such as depression, anxiety, suicidality, and increasing suicide risk. Burnout has been associated with pervasive microaggression and hostile work environments. Even physiological outcomes such as hypertension, cardiac events, and chronic pain have been linked to microaggressions that remain unchecked and are a part of organizational culture in certain settings. There has also been reports of harm to self-esteem and propagation of very undesirable phenomena such as imposter syndrome, as well as stereotype threat. This has been studied in multiple situations of test taking where gender and race has been revealed, performance, as well as evaluations of trainees. So it has a lot of impact that's not readily measurable, and that's why they are so important to recognize and address when we see them happening. So how do we address that? Well, let me start by asking, have you ever experienced a microaggression? And I can imagine a lot of you, after listening to the definition, probably feel yes. Or have you ever witnessed a colleague being subjected to a microaggression? I would imagine once again that it's not uncommon for us to witness others facing a microaggression. Let me also ask you a question. How did it feel when you witnessed or experienced a microaggression? I can tell you from anecdotal experience and all the research that I shared earlier, this does not have an uplifting impact when this is happening to us or our colleagues. I think a very important question here is, sure, we can be cognizant and more aware of microaggressions, but do we have the skill or tools to address microaggressions when they are happening? And this is where the hidden curriculum in medicine comes in, and we need to make it more explicit.